Welcome back. I know there's people out getting snacks still, but we're going to get started so that we don't extend it for all of us who made it back here on time. I hope you enjoyed the break, and I did. I love the macarons. So let's just jump right into it. And we're going to begin with Susan Pennock and supplemental instructions for end-of-life care with ALS.
Hey, thanks for joining me today. My name is Susan, and I'm going to be sharing a little bit about this document I created called Supplemental Instructions for End-of-Life Care with ALS, or MND, if that's what it's called, where you're located. So my name is Susan Pennock. I'm a licensed clinical social worker for ALS Northwest, located in Oregon and Southwest Washington in the United States. I'm very passionate about palliative care as well as death and dying. At the age of 19, in my freshman year of college, I actually took a death and dying course. And my first break back home, I actually sat my entire family down and made them fill out advance directives, which no one had done yet. So I was glad I did that, and I just think it's important for people that are willing and ready to think about end-of-life choices and share those with their loved ones. So currently each day at work, I'm helping people with ALS kind of find that best quality of life and help them live that. That's my main goal. But also for those that are ready, to help them plan for what their passing might look like and help them be able to achieve those wishes as well. Disclosures, none. I'm a small-time care service coordinator in Oregon and Washington, so no one is paying me anything, so we're good there. My objectives today are just kind of to share the importance around having these end-of-life discussions with people living with ALS or MND and why we want to talk about these things as soon as someone's ready. And most importantly, offering a more specific end-of-life discussion and material for someone with ALS so they feel like they have a little more specific information to make those decisions on. And then also just a little bit talking about timelines of when we could do this type of work as well. So hopefully we can get to all of that. So for end-of-life discussions, as you can see on the screen, and hopefully you were able to get a copy of this document as well, those first 3 or so pages really are all about just helping kind of set the scene or to get people thinking about end-of-life decisions. So we leave more kind of open-ended space and questions for people to think about what is quality of life? What does that mean to me? Have I been through an end-of-life process with someone else, and what went well and what didn't, and what would I want to do or not do, as well as looking at what these end-of-life decisions, where they might affect other people. So looking at things like legacy and family and cost of some of the choices people might be making. Like I said, we try to use some really open-ended questions to get people to think. This is not the space to be checking yes or no boxes. It's to give people that time and space to really think about what quality of life looks like for them. Now, of course, this is something that someone could sit and do on their own. Or they could have a discussion with loved ones as well. It just depends on the person and what they're more comfortable with. But you can kind of see as you get a chance to look closer, at these pages that, it helps someone look more to quality or quantity. And, sometimes I've met people that quantity, more time is quality. That's what they want. And once that we know that that's quality of life to them, then that's what we do, right? We push and pursue and advocate for them to get what quality of life looks like to them. So these first pages really are just to help them figure that piece out. So who can people talk to? Obviously, the person with ALS, right, should be talking and thinking to themselves, as well as loved ones. And also religious leaders or people like us or trusted medical professionals or people like me, a care service coordinator. I think occasionally, for some people, it helps to step just a bit outside of that medical realm. Sometimes people feel it's easier to talk to those sorts of people, but for those wanting to do this type of work, I think they really can talk to anyone that feels trusted to them, whoever they would want to get the input on for these sorts of decisions. That's who they should be talking to. So there really is no specific number of people. They can talk to as many people as they want to. But as kind of professionals in this realm, I think it's important for us to know that we are on this list. So it's important for us to be open to talking to the people we're working with about this and letting them know that we're one of those people that they can talk to if they're wanting to. So to get more into kind of the specifics of ALS and these end-of-life decisions, this is where the remainder of the document kind of is. So when we look at advanced directives, it's a little more basic, right? I do or I don't want a feeding tube. That's kind of it. As you can see here, we have those same options, but we talk a little bit more about with ALS, what does that mean when I make that decision? And not only what does that mean right now when I make that decision, but what does that mean later on? What am I giving up or what am I gaining by making those decisions? So as you can see, there really are only the two options around a feeding tube, saying that no, I don't want one, or yes, I do. And we start by just talking a little bit about, hey, why is a feeding tube even something that's coming up with ALS, right? We talk a little bit about why speech and swallow will likely go at some point and why this is what is medically recommended. Then at the same time, so we talk about, okay, someone says they don't want a feeding tube. Great. We just want to share what that would mean. We want to share with you what that might look like so that you understand the choices that you're making and how that's going to affect your life and maybe your quality of life. And once people have read that, and I know that they understand that, hey, you may likely choke a lot more. You could pass from choking. You may aspirate a lot more, and that can lead to pneumonia. Once I know that I've walked through these kind of concerns with someone and they understand that these are concerns and they are things they're willing to take on because a feeding tube means poor quality to them, then I feel okay because I know that they understand the decision they're making. For some, they may not have realized that not getting a feeding tube means these things. So then we step down to, okay, well, maybe I do want one. But I don't want people to use it when I don't want them to. And I always try to remind people that a feeding tube is just like your mouth. You get to decide what goes in and out of that feeding tube. So we can kind of walk through, okay, you've decided you do want to get a feeding tube, but when do you not want that used? So now we're stepping into that, okay, you've made your decision around a feeding tube, But at end of life, how do you want that used? When do you want people to stop giving you nutrition and hydration? Those sorts of steps. So people can really feel like they have their power back over these sorts of decisions. And again, there's places for them to write what they want. They can initial, sign if they want to, or this can just be a discussion piece that they're having with us or their loved ones. So then the next pages are looking at those respiratory decisions. And there's 3 of those respiratory decisions or options that we look at. Again, we start with, I don't want anything. I don't want any respiratory support at all. Right? And again, we walk through, okay, if that's your decision, I just want you to understand what that means and the pros and the cons of that decision. And if that fits with what you have decided your quality of life is, great. As long as you understand that, I'm going to fully support you in that decision, and we're going to work together to make that work for you. If the person is like, ooh, never mind, that actually maybe doesn't sound like what I think quality of life is, we move down to that non-invasive ventilation, right? And we talk a little bit about what is that? What does that mean? What's non-invasive ventilation? Why, when would I want that used during end of life? So again, we're stepping into that. Okay, now I've decided, yes, I want that, but here's when I don't want it used anymore. So they're getting that option of like, okay, I do want this, but if I'm not communicating with you anymore, if I'm unconscious, if I decide I'm not having good quality of life anymore, I want this mask taken off. I don't want it used anymore. Those sorts of things. Or then we step into that third option of invasive ventilation, right? That is a choice. And we walk through those pros and cons. What does getting a trach and being on a vent mean? What are the pros and cons of that? You're going to get more time, right? That's the pro. You really just will get more time. But what does that mean to be on a trach and vent? There is going to be a higher cost of care, right? There's going to be some cons. So we want to walk through those with people to make sure, again, that they're matching up to those first 3 pages of what does quality mean to me? So once we walk through those, again, even at that invasive ventilation stage, we want to walk through, okay, but what is your line in the sand, right? What is that next piece? When is invasive ventilation not quality of life for you? So again, giving people that power back to help make those choices now or earlier stages, as well as at end of life with those choices. So timeline of this work. Really, I think if people are ready, you can have these discussions at diagnosis. I would be one of those people that would want to have this discussion then. And there are the occasional home visits that I go on that I'm working with the sort of people that are ready at diagnosis, and I'm handing this document out that early. For others, they're not ready, right? So other times where it might come up is at medical appointments or check-ins, or if you do ALS or MND clinics, those would be good times to check in and see if someone's feeling more ready to have these discussions. Or you're noticing some major progressions or major changes in someone, and they're getting a lot closer to having to make most of these decisions. Ooh, now maybe they're ready to talk about these. Or maybe they've done some of this work and some of these decisions are coming into play. Maybe they did get a feeding tube, right? So kind of revisiting those or starting to talk about them again to see if everything's still matching up. And then, of course, ongoing check-ins. If someone's done this work, let's keep checking in to make sure that that quality of life piece is still matching up. That's our goal, is to keep matching quality of life up with them. That's what we want to do, is keep providing that for them. So that is my presentation on supplemental instructions for end-of-life care. I believe there'll be some question answer time, but there's also my contact information. So I'd like to thank you all for joining.
Thank you so much, Susan, and thank you for joining us here today now. I don't know if you were on at any other time during the day or yesterday, but there was a discussion about risk and some of the things you were saying about, well, as long as you have this information, then you can make the decision, seem to fit right in with that.
Oh, good.
So are there any questions here or online? I don't see any at the moment, but I actually do. All right, there's one in the back there. We'll go with you first and then. Just keep talking.
Yeah, hi. I'm Natasha from Denmark. In Denmark, we keep those papers in the journal at the hospital. Where does these papers stay when you've filled them out?
Yeah, if someone has decided to fill one of these out, an initial end date and sign it, we recommend that they attach it to their advance directive and do have it scanned into their medical records.
All right, and then my question was, you had mentioned the line in the sand, and that actually came up earlier in the discussion because line in the sand is a good way to say it because then you can always just change. You know, it's
Right.
the sand. So how often do these get reviewed, and are people told that they can change them?
This particular document is very new. I created it a year or two ago, so it's not something I think that's reviewed often just because it's so new. I think with a standard advance directive, at least in our clinics here, we do attempt to review those when there are kind of major changes or progression in the people with ALS that we're seeing.
So not a time, but more an event.
Yeah.
All right, and there is a question here.
Hi, Susan. This is Susan as well. This information is obviously really important for the wider multidisciplinary team because it will influence our communication and conversations that we as individuals, I work as a physio, that we have with that patient. So I know some of our clients, when they've gone through this process in our country, that we also keep a copy at home. What is relevant to our profession is that information with consent is disseminated to us as well, because if I'm not going to engage much in lots of conversation around ventilation, non-invasive ventilation, if it goes against the wishes that that person has expressed. So, you keep the conversations quite short and brief. I'm not going to go into depth unless they change their mind in some way.
Yes, agree. That's why if someone has decided to fill this out and share it with their medical team, we do like to put that in their chart. And we, at most of our clinics, I work with a bunch of clinics here, most of them in just the notes for each clinic, they have a lot of these decisions marked down. So it's a quick look for the team to know like, oh, we already discussed this. They've already made their decision on this. So we know that day and in that moment, hey, we don't need to talk about this. They've already made that decision. So that's very helpful.
All right, and there's another question down here in the front.
Hi, Susan. This is Christina from Switzerland. Thank you very much for a very informative talk, very important. When you sit down with the ALS patient, do you sit down with their loved ones as well, or with, or just with them themselves? I've noticed that sometimes when the loved ones are with them, they're hesitant to tell me or explain what their wishes would be, so they don't hurt their loved ones, or the loved ones have completely different ideas of what their quality of life should be.
I completely agree. And I think it differs with each person. I try to meet everyone where they are. Sometimes I'm discussing this just with the person with ALS. More often than not, families have already had these types of discussions, maybe not as in depth or specifically around ALS. So they're open to having these discussions together. I've also had discussions around this document with just family caregivers or spouses because they want the information and want to kind of know what's out there. And then maybe they feel like they can address it with their person later on. So it's trying to meet whoever's in front of me, wherever they are, in the hopes that they'll get the information when they're ready.
All right, and I think that's a great ending, and we'll all just thank you very much for your presentation.
Thank you.
And now I'd like to welcome up David Meisner for his presentation, Improving Quality of Life Through Education.
Hello, my name is David Meisner, and I'm going to talk to you today about our website, Your ALS Guide. And then after that, I'm going to talk about a new home and daily living guide that we launched in April. And this is something that we presented about that was coming soon in San Diego. We presented then. And then I'm also going to talk about our equipment guide and then wrap up and take any questions. So this began when my aunt was diagnosed with ALS in 2013. She was a retired fourth grade teacher. She passed away in 2015. She actually decided not to have a feeding tube or a vent. She was just pretty certain of that. And throughout the process, I was living in Colorado in the US. She was in Arizona. I would go back as often as I could to see what was happening, connect with her. But it was a game of telephone, and we had a connected family, but we felt like it was constantly a game of telephone where people are wondering, the clinic said this, what does she need? What kind of brace does she need? So my dad and I were talking after she passed away and thought that we should develop a resource for other families that would help people not have to figure these things out themselves because it's such a difficult time already. So my background is in writing, education, content development, video. And so what we did is connect with Kim Hughes, who's on the bottom left. So the ALS Association in Arizona took fantastic care of my aunt. Kim was the director of care services at the time. She had worked with her for 12 years. I had never met Kim until after my aunt passed, and Kim was leaving the association independently. So we got together. People had told Kim she should write a book. She knows so much. She just had all this institutional knowledge. And that was really a big part of why we developed this site, is that all of you have such amazing knowledge. It's spread out. Sometimes it's hidden away in PDFs in a clinic, and we just wanted to institutionalize as much of that as possible. So we're essentially an educational hub, free website, try to make our information clear to the average family. It's family-facing, but it's also a resource for professionals and a resource that professionals often share as well to help improve quality of life. So our site, we try to design it as simply as possible, partly because of budget and partly because we just want to make it easy to read, to access, to navigate. But there are more than 250 web pages on the site, 300 original videos that we filmed with, for the most part, professional camera crews going out in person. There are headshot interviews. We also do a lot of demos and things like that. So when you look at the site, hopefully it feels like a simple, friendly experience, but there's a lot of content the more you drill down. So we launched in 2017 with core content, such as health insurance, medical decisions, clinics directory, care options. And then and our traffic was doubling year over year. It continues to grow. So we realized, okay, this is a resource that's really important to people that is helping. We hear a lot from clinics, from professionals, that they put our flyer in their new patient packet and think it's a really good landing place. And then one thing that we do is link out to as many good resources as we can. So whoever it is, if they have something, I was just taking a note that what Susan developed here, I thought would be fantastic on our advanced directives page, right? To have a link and send people out to this resource. I'll have to ask her first, but that's the way we think. So if you click on self-care, for example, you'll get these different options down here. So you'll see, just these different topics once you start to get into the site a little more. And then, like I said, we have these videos. We did Dr. Bedlack. We were about to fly out in April of 2020 to North Carolina, and something called COVID happened. So we had to develop a remote kit, mailed it out to him, and filmed, and that worked out. But we have a lot of videos with family members, professionals in different areas, and the videos complement the text. So we have a lot of text throughout the site. We try not to do too much. We try not to overwhelm. We try to break it into smaller chunks. And then people can learn what they want when they want it. And then after we felt like we had a pretty good baseline of content throughout the site, we decided to really drill down and develop some more comprehensive guides. So we have a newly diagnosed guide that we worked with the Duke ALS Clinic on. We have a respiratory guide. We had a respiratory therapist, a nurse who had worked at the Mayo Clinic in Arizona, who we filmed and gave us a lot of content. So Kim knows a lot about ALS, but we obviously partner with outside experts to really vet our content. They let us know what they think should be included, and then they do a final read. And then we also have a braces guide. We have a power wheelchair guide. We're going to be updating that hopefully in 2024. And then I'm here to talk to you about the Home and Daily Living Guide. So I would not be here if it weren't for Joel Goldhirsch. Joel is an amazing, brave man living in Colorado who has ALS. And he has long-term care insurance. So they had the luxury of bringing in professional caregivers, but they became very frustrated because they didn't have the training that they would have liked. And I'm sure this is no surprise to you all, but you might have a well-intentioned, very experienced caregiver who does not understand ALS. So they were frustrated with lack of retention, among other things, and just people coming in and not knowing what they were stepping into. So Joel was looking around. He was talking to some different ALS organizations about developing a guide for paid caregivers. At the time, we were developing a home and daily living guide on activities of daily living, and we realized that ultimately we're developing a caregiver's guide. So we merged our visions and decided to work with Joel and his wife, Karen. We went out to their home and filmed with them for a couple of days, and they were very involved in the content development process. So we collaborated with a number of different professionals around the country, and our primary collaboration was with the ALS Hope Foundation. So this guide would not have happened without them. So a number of them are here, including Sarah, who's your wonderful moderator. And so we flew out to Philadelphia August 2022 to film with their team. We went to their loan closet, just pulled everything out and did a bunch of filming, and they were fantastic. And so that was really the core of the guide. So like I said, we have, sit-down interviews, often 2 to 5 minute clips. These demo clips tend to be longer. To the right, for example, you'll see Sarah doing a 10-minute video on a Hoyer lift and just really walking you through how to use it. We pulled out all the mobility equipment, range of motion videos, so all of that is on our site in this guide. So I like to say that this Home and Daily Living Guide is essentially a website within a website. It has 16 pages, very deep. There are 90 videos alone just within this guide. So this is the homepage of the guide. If you go to our website, you can scan this QR code. That'll take you to the guide itself, but you should be able to find the guide pretty easily on our homepage. So these are some of the different topics. So safety and accessibility, activities of daily living, and so we just really try to dive into those. A lot of these we really focus on strategies as well as devices, right, for improving quality of life, often coming down to independence, conserving energy, safety. And then we added on some other topics. So Mary, who is the mental health specialist at the clinic, talked to us about just the importance of mental health, and it's something that's often overlooked. And so we thought we can add it into this guide, and then it's also something you can just find as a standalone piece on our site. Smart home is another interesting area where you can find, if you use smart home devices around your home, that obviously can give you a real sense of independence and true independence that you might not have otherwise. And then, so this is what the top of one page may look like. You may notice Donna here in the audience in the bottom video. She talked to us about food modification, swallowing safety, things like that. So this Eating with an ALS page goes into maintaining weight, hydration, all of those things. And then this is just a little snippet from the transferring page. So as you'll see, we have text. We try to keep it, as short or long as it needs to be, hopefully clear, not talking down to people, but not getting too technical either. And yeah, all these devices that complement all the videos that complement the text. And then in conjunction with this, so we launched that has 16 pages to the guide. This is another page. It's a deeper page, and this one's specifically for paid caregivers. So the whole guide can be helpful for paid caregivers, family caregivers, people living with ALS. This page in particular speaks to caregivers. So what we're trying to do next is get out and connect with professional caregivers, whether they're independent or agencies, and hope to use this as a training tool and hopefully go a little deeper as well, and so that people can really have a sense that there's some at least baseline understanding of what ALS is and what they can do, where they can find support, connecting with professionals like yourselves who can help answer questions, things like that, what kind of equipment they might use. And so we launched that other guide, the Home and Daily Living Guide, in April. We just launched the equipment guide in time to present at PACTALS, the Asian conference presented by the Alliance. And so we developed an equipment guide, and Kim's background is in equipment, and she always talked about how there are so many things that people use that are just little hacks, little life things that improve quality of life, and just wish she had written them all down before she left her, daily on-the-ground job. So we've slowly pieced those together. We've talked to people like Sarah, physical occupational therapists, who know a lot of these devices. And you hear people talk about, there are these zip-on shoes, or there are these other things you can use, but they're often not in one place. So what we did is try to put them all in one place. So we have 200 devices here. We still need to add some sections like communication, braces, but we have places where people can also chime in and say, hey, you missed this. So we're always open to evolving. So these are pretty parallel topics to the Home and Daily Living Guide. And then this is what a page might look like. So we actually have links to Amazon. So you can, we decided not to just look like a pure online catalog. So we have just a little information about what this is, right? Because if you're steeped in this world, of course, you know what a raised toilet seat is and why you have it. And here we want to just give little explanations. And so we have links for Amazon. And then we've negotiated with a couple different manufacturers some exclusive discounts for the ALS community. So through a couple manufacturers in the US, you can get 15 or 10% off different devices. And then for people who are not in the US, where these companies don't ship, we have an Amazon link as well. So obviously we're here in Switzerland, so I just wanted to talk a little bit about the international applications of your ALS guide. We are based in the United States. It definitely is that's just where we started, and so it is US-centric in some ways, but I would say 80 to 90% of the information is universal. There are definitely a lot of references to Medicare and things like that are in the United States. We have a US clinics directory, but we do 17% of our traffic at this point is international, and that's been ticking up. I don't know if you heard earlier in this conference, there's a global clinics locator that Pat Dolan and his team are creating and along with the Alliance. And it's fantastic because we'll get emails from people from different parts of the world and say, can you help me? Is there somebody near me? And so this is a very new initiative that's going to be, they're going to be filling in all this information from member organizations and others. So we're going to try to help them spread the word as well about this, and then link to it and send people to the International Alliance site so that people can find assistance near them. Support services as well. We have a few international organizations listed, but we'd like to really up that. So first, we're kind of revamping the way we're letting people know about American support service organizations. So everybody, whether you're ALS Association, independent organization, we want people to find you. So we're always sending people to get what's best for them. And then we hope to add more international organizations as well. In the future, we'd love the idea of translation. Obviously, that can be tricky when you're updating your content a lot. And, we don't feel comfortable just doing some AI translation that's not going to be great, but Spanish would be the obvious first language for us being in the US and just different parts of the world. So I've talked to Marcel and some other people about this, and we would love to have that on the horizon and have this information accessible in Spanish as well. Something very new that started happening is we've had some organizations say to us, we have some gaps in content. Would you be interested in licensing some of this content for us or having us link to it? So we have started a new content licensing program. So if there's an organization in the US or out that feels, we need some information, we'd love to have part of your respiratory guide on our site. That's a conversation we could have. And that's the kind of thing, if it's an international organization, it could be something that, you license content and then you can do that, your own translation to make sure that it's correct for you on your site. And obviously linking, anybody can link and do that. And so we're just happy to have those conversations. And then we're also developing a series of flyers and PDF handouts. So we have flyers that are just about the site that people can put in new patient packets that say, here's the URL. They're out on our table out here. But then we're also developing informational PDFs that people can hand out, because I've heard stories, people are often kind of running to the printer right before a support group and want to talk about a certain topic and have information, so we could have that information that, kind of condense our web pages into a front and back page print format. So we have a few different channels. We have our newsletter we send out, we keep it pretty short and sweet. ALS news, new content updates. Oftentimes we'll feature other organizations that are amazing. Like I was just saying to Joe here, he developed this amazing tool, and once it's digitally available, we'd love to have a block in our newsletter and send people there. And we often have a lot of interest when we feature other great content or organizations. So that's something that we do. So that newsletter goes out at this point to about 4,500 people, often professionals, mostly families and professionals. Facebook, YouTube channel, where I still need to put the rest of our videos there, but coming soon. So all our videos will be there in one place, as well as just integrated throughout our site. We're a little light on Twitter, but we're on. And that's about it. Kim Hughes is in Arizona. She's our content director, but I can take any questions.
David. Are there any questions for David? Susan, over here.
David, in regards to the videos, how long are they in length, just out of curiosity?
Mm-hmm. We have some as short as maybe a minute, minute and a half, and then they may go up to 4 or 5 minutes. So we try to keep people engaged, right? So what we do is we'll interview people. I don't script anything out, but then we go up and we kind of chunk it up and edit together so that it's a nice experience in that sense. But then, like I said, some of the demo videos are definitely longer when it needs to be longer.
Over here, Gudjun.
Yeah, this is excellent stuff you got there. Is this Alt Hope Foundation, or is this a special branch?
Good question. So you're asking if we're related to the ALS Hope Foundation? Or if this is one of their sites? So this is an independent site. So it's a site that I started with Kim and my dad and myself. And it's just, we started out as a family project, wanted to see if it was something that would be helpful to people, and it was. And so we just continued to build and build and build. We partner with lots of different professionals around the country. ALS Hope Foundation, we partnered just on the Home and Daily Living Guide. But it's not just Sarah, I know. And Sarah did a lot of our editing, so it's our centerpiece.
No, I did.
It's our centerpiece of our site for sure. But we didn't actually know the Hope Foundation until maybe 2022. We started talking to them in 2021 maybe and developed this project with them. And now we're very close collaborators, and we're still open to collaborating with anyone. We really feel like in the ALS space, it's important to raise everyone up, connect with whoever has great resources, and we just want to send people in that direction, because at the end of the day, we're a website. Do
you work with other associations like Les Turner, or they all have some kind of guide to living?
Yes, absolutely. One of the things people talk about in the ALS space is trying to not create redundancies, right? We all have limited time and resources, so we want to try to complement each other as much as possible. So, for example, Les Turner, we were just having lunch today and talking about some different possibilities of areas of collaboration. So we see that on the horizon. We've definitely worked with Les Turner before and talked to them. We link to their decision-making tools because we really think they're valuable. So we're always doing that. And then on IMALS, for example, we work with them, and they were going to develop educational content, and they said, you know what, you're already doing this. We're focused on advocacy. We're just going to link to you a lot within our, when people are trying to learn about living with ALS. And then we also tap into, so on our Home and Day Living Guide, you can see all the different collaborators. So there's a man, Matt, who has Matt's Place Foundation. He's living with ALS. He and his wife, Teresa, helped us with our home accessibility and home safety pages. Someone from the ALS Association helped us with our smart home page. Mass General, we had PTs and OTs helping us vet content. So, yep, open door.
All right, there's a question over all the way to the left.
Hi, David. This looks awesome. Joe from Australia. We get a lot of requests from people who are caring for people with MND-ALS for education, which we don't have a great deal of information or resources available. I'm just curious as to what feedback you've had from sort of either paid carers and how they access and use the guide.
The paid caregivers? Right. We've just started the outreach. So one of the things that was really important to Joel was not just, he's very happy with the content, and we get a lot of great feedback from you all, the professionals, from families who have been using it. But the paid caregivers, we've just started to figure out what is our best way to reach out to these different agencies. And so far, we've not been getting great response back. So that's one of the things we're actually talking about with Les Turner and the Hope Foundation today at lunch was how could we maybe join forces as well to get out and to reach them and to get that feedback, because that's how you're going to improve, right? We're very open to hearing what's not working on our site and trying to improve it. So hopefully that's coming soon. And, one thought we've had is, could we develop a little bit of a mini training course at least so that we know that people have looked at that and formalized it a little more. We've just had to catch our breath after launching 2 big pieces of content, but that should be coming this next year.
All right. Why don't you, there is one quick one. We're at the end here, but.
Okay. It's a long question, though. Let's just end with everyone. It feels very grateful to your ALS guide. That you got a lot of kudos. One quick question, I'll paraphrase it, was, do you have a one-pager on your site that pals and CALs can carry with them that gives some information, kind of like the emergency guide, do not give me automatically give me oxygen, et cetera, et cetera? Do you have that on your site?
We do not. What we are in the process of, we don't have a lot of downloadable handouts front and back, but we're doing that right now, and we're talking to different organizations to find out what the gaps are and what could be helpful for them. So more than happy to create something like that. And maybe that's already exists, right? And so we can
have one that we borrowed from the NHS, so thank you very much.
Well, let's just use Les Turner's, why not? Yeah.
Well, it's the NHS's that we borrow, but we adapted it in the ALS space.
All right. Again, thank you very much, David. Tried not to take over his presentation. All right, our final presentation in this section is actually a demonstration of a creative app from Richard Cave. And it's gonna work this time.
I think you're cheering because it's the final session, right? Now, I want to start with a public service announcement. And I don't have a vested interest in this, but I hear that if you mention stuff about Canada, then there's a possibility of free socks and stuff like that. And, I'm not particularly interested in that, but anyway. So my name's Richard Cave, and I'm a speech therapist. I am not based in Canada. I'm based in London, England. And I am going to talk about Mind's Eye, which is a tool for expression using art. And I have a special guest as well, Rick, who is going to who has been test driving it the whole afternoon. And so Rick will give his unvarnished opinion just like normal. Now, I don't know if I've... So I'm going to talk a little bit about AI, because this is artificial intelligence in practice. This is AI-generated art. This is what AI, I think, should be. Going to talk about Mind's Eye and we jointly co-developed it with people living with MND ALS in England, and I'll tell you how they're using it. I think there's over 1,000 people using it currently. It's only been out a couple of months. It's a free, just to put it into perspective, it's a free grid set in Grid 3 and Grid for iPad. So if your ALS clients have Grid 3 or Grid for iPad, just go into the online section and there it is. That's it. Going to do the demo. I wanted to demo it live, but the video graphics didn't quite work out here, so I do have a recording of me doing it live. So it's a recorded live thing. And then I'll tell you where it all came from and then the next steps. So AI is this thing that's literally everywhere, and we're all talking about it. And the question is, what is it? And lots of people will give you technical answers, none of which I understand. But what I'm far more interested in is actually what it can do for us. And one of the things that people are talking about in terms of how AI can help us is that for our clients that use stuff like eye gaze, traditionally, e.g. between now and the year dot, communication using eye gaze has been incredibly slow because people are just kind of selecting and pre-storing messages, and there's some auto-suggestion. The idea with just one idea is that you can use AI to include other modalities to get a better understanding of where people are, what the context is, and who they're talking to. And so the idea is that AI could potentially put all that stuff together, so any auto-suggestion for people using eye gaze will be very relevant to the person they're talking in the place they are. And that feels like an application that I would be interested in. But there's lots of stuff talked about, and that feels like that's something that could help our guys. And so, artificial intelligence is a tool, but actually it's all about us. That's what this is. It's not a thing out there. It's actually about us. And actually what AI is, it just collates huge amounts of data, massive servers, and it kind of makes judgments. So it's really powerful. Oh. There's one problem though, that unfortunately I have not seen people living with MND ALS discussed in terms of how AI is and what people are doing. I was following a TED talk about 6 weeks ago where the great and the good talked about AI. The experts, there were 35 speakers over 2 days. And I was waiting to hear what one of the speakers, or any of the speakers, would say about inclusivity and accessibility for our guys. And I'm still waiting. So there is something here that is missing, and it's our voices and it's our clients too. And yet AI is extremely powerful, and it's already here. It's a solution searching for a problem. But the thing is, no one's talking about the work that we do. So we need to be involved. And we've talked about this earlier, that this is advocacy, and it's advocacy which we as clinicians and professionals working in this space, this is us. And I know from speech therapy land, which is where I come from, it feels like I'd like to deal with people. I like to deal with people. But the people I work with could benefit from this technology, so I need to talk about the technology too. So we as speech therapists, we as professionals, we need to advocate with big tech and other companies that have this stuff. And people may know that I work part-time at Google. I am the hired help. People call me the nag because I say the same thing many, many times. And what I know is that at Google, as at other big tech companies, they are super bright. They're half my age. They want to do the right thing. They can code like crazy. But the problem is they don't really know what the right thing is, and yet they're building stuff for us. And so what we have is groups of people who really can do loads of stuff, but we need to bring everybody together to get the right stuff done. So that's my job there, but this is something that all of us, whenever we get the opportunity to talk about. Co-design is something that we're all passionate about, and it's not just part of a project, it's all the project. And I try to do that at Google. It's very hard, but it's just something that we have to do, and it can be done. This is another non-profit that works with people with sight loss. Are working right now with OpenAI. That's the ChatGPT folks, and they're working together. So it can be done. On to Mind's Eye. So this is Art for Expression tool, and we know that if we get the opportunity, we can work with AI to work for benefit of our clients. And, you know, it's like, what is it? Well, it's nothing really amazing. What it is it's taking two technologies that exist already and putting them together. So the first technology is this AI art generation tool that's been out for a long time, but really hard to use. The other technology is Smartbox Grid 3, which has been out for a long time, and many of our clients use. And we put them together. That means that people that use eye gaze, head mouse, switch, direct access, any combination, go create. So I'm going to show you a live video. And I'm sorry, I can't.
Let's just do stuff. So
I'm just typing something in.
how about that? So happy to meet you. And you can just, if you want, you can just click on Imagine and it will just do stuff straight away. It'll just create something straight away. Or you can go to Vibes, which gives you a choice of kind of themes that you can just go for, like sci-fi, cyberpunk, magical, colour photo, all sorts of interesting stuff. Or you can go for custom, the whole deal, so that over 100 options that you can choose, any number or none if you don't want to. The medium, like a watercolour, the artists, I don't know, Claude Monet, Wes Anderson, great film. Style, Impressionism, Bauhaus, pop art, details, octane render, whatever that is, intricate detail, lighting, I mean, it just goes on. And so you could be as detailed as you like if you have an opinion on these things, or not. You could just choose one or even none. Or if you want to add a new artist that you would like to base your art on, then go right ahead. So just going to go back, and so we've got So Happy to Meet You. I'm just going to imagine that's just one click. I haven't got time for anything else. Let's do one click, see what happens. I've got no idea what will happen. Hopefully something will. And so that's the first image, and we can reimagine as many times as we like. You can just keep on going and just see what comes out. So that's quite colourful. I'm going to edit now, and I'm going to go into Vibes. I'm going to copy that just in case I lose it. Okay. I lost it already. So happy to meet you.
This art is unique. It's just generated on the fly.
Copy that. just in case. I'm going to vibes, and so, you know, I don't know. How about cute? Let's do cute. Let's do cute. So, just see what happens with cute. That is cute. That is cute. Reason to reimagine. That was very cute. And, oh my goodness, that's pretty damn cute as well. So I'm going to close that, and I'll put in so happy to meet you again. Go the full hog with custom. So I don't know, watercolor. Artists now, I'm a big fan of Impressionism, but I'll go for Monet, but I could have gone for anything. Style, Impressionism, I don't know. All sorts of things. Details, cinematic, lighting, it just goes on, doesn't it? It just goes on. Volumetric lighting, how about that? I've got no idea what that is. And then colour, camera, I can't be bothered. I don't really understand. But other people do. So you can have as much control or as little as you like. And I think that is beautiful. Let's just reimagine and see what else comes up. Literally, I have no idea what will come up. And that's the beauty of this, that it's just created on the fly. No one has ever seen these images before. And that's how this works. So, great. All right, and if you want to share your images, you can share to the public gallery. Problem is I need to log in to do that, but I could do that, and then share it, or I can copy and paste it and send it off to my friends, or not. It's entirely up to you. So, anyway, I'm so happy to meet you.
Yeah. So, worked with 5 people living with MND ALS, and just asked them, gave it to them and asked them what they were using it for. And there were kind of these different use cases. The first was just like having fun, just doing stuff, being creative, just doing stuff, which was very nice. The second one lady working with, she is using it for personal reflection, on just kind of helping her to think about where she is right now. The third was about sharing feelings, and they say, picture's worth 1,000 words, and particularly if you're an eye gaze user, it can take a long time to type out exactly how you feel. And this is just another modality. Another thing was about demonstrating competence, just a way to show that I'm still the same person inside, even though it's hard for me to move, and it's hard for me. And also kind of communication. And this one is was typed "I love you" on that one. So what I've learnt is that it's better to talk about ideas and to kind of pool our heads together. And when it comes to innovation, it's better to be social than smart. Thank God for that, because I'm not smart. And it's just really great for us to be together and actually talk about this stuff. It looks like I'm up to my 15 minutes.
Oh, yeah.
Okay. Okay. All right. Well, thank you very much. And, when we do good things happen. So thank you, everybody.
Thank you, Richard. It was all that blatant Canada thing that put you over the edge. So I believe there's a question right down here in the front. So everyone else can get their questions ready.
Hello, I'm Rick. I am an artist, and as you rightly observe, you gave me this iPad earlier on. When you get it back, I can assure you it'll weigh about 15 times what it did when you gave it to me, because it is full of pictures. I have had such a brilliant afternoon, just creating many, many pictures of reflections, all the kind of things I love doing, art, light, trees, mountains, fields, flowers. And I can tell you that I haven't explored any of the fancy buttons. I just simply, for example, wrote tempest, storm, vibrant, horizon, surf, and pressed imagine. And I got the most amazing, fantastic picture. And then I got the most amazing, fantastic picture. And I kept on getting the most amazing, fantastic picture. And so my question is there any need for a question? It's just...
There is no need for a question. Thank you, Rick.
Well, we all want to know, is it only on Grid 2? But thank you, Rick, for sharing that. And I'm sure he'll share if anyone wants to go up and see the pictures that he's made so far. So we do have time for more questions.
I'll be super quick. Susan from Australia. I think this is such an exciting space. I love the idea of AI and where it's going, and it's coming, it's here, and it's just going to increase at an exponential rate. I actually used AI in my presentation. My last image in my presentation was AI generated.
Yeah.
And it took a while to get the right language, but it did. For me, I felt when I created it, it portrayed everything that I was trying to say without using words. And it was a fun process, so I can see the value in the art and where it comes from. So,
Lovely. Thank you.
Was there another question back there?
I love these questions because I don't need to answer them.
So there is one online.
Okay.
Well, this might be a social question, but it's also a smart question, and it comes from the problem solvers. He said, thanks, Richard. Any other AI platforms? I'm sorry, I skipped it. This is from the ALS problem solvers. My intention is to use AI with Daniel Boyce and dive into the doctor's notes and the EHR systems to extract ALS info to speed diagnosis. Do you know anybody who's currently working on that?
I don't. I wish I did. Does anyone know? Yeah, John?
I'm just aware that there is work being done with electronic medical record systems, including rollout of new Epic systems that we're exploring to understand how to quickly pull out information, and it is using, as you rightfully pointed out, pretty much everything around us is using AI.
Yeah. That was actually on reflection. There was a panel of eminent consultants here a couple of days ago, and they were talking about plans for kind of all their research and all the rest of it. And I was itching to ask them, we have AI. It's been around a year, and it's still going longer than that. It's still going. It's accelerating even now. How can we accelerate clinical trials? How can we do that? And at the very least, I'm sure that that we should be thinking about that. And yeah.
There's loads of people who are working on that. And then the other question from Turkey was any AI platforms for composing music.
Anyone know of any AI platforms for composing music? It would be fantastic if there was.
We had something last year, but I don't remember what the name of it was.
I will
do a Rhythmo, but Albert's involved with that.
Oh.
I will take that as an AI.
All right.
Action item.
Well, then that actually brings us to the end of this session.
We made it.
We made it. That was very exciting. That was very, very cool. So, you may have heard that next year we're going to be in Canada. So I'd like to invite up, who am I inviting up? I know I'm inviting up Tammy. Is it just you? Yes. I'm just inviting up Tammy Moore from the ALS Society of Canada, because Claudine is in the snow somewhere. Thank you. And I left the socks.
Thank you, Sarah. And I think this time we're going to play the video after. Now, I know we're late in the afternoon, so we want to be quick, and I know that there have been socks on the tables. Carlos, where are you? Are you still here? All right. I think some socks may have left in some people's bags along the way. So the way we're going to do it, we've got some quick Canada trivia. The first is ALS in Canada or Canadian ALS, and the second will be something about culture. But first, I'd actually like to offer a few remarks from my colleague. So ALS Canada and ALS Quebec will be co-hosting next year. Claudine Cook was supposed to be here. She did land in Munich on Friday, and she is now in an Uber on her way to Basel. So she shall be here soon. But she would like to say, bonjour, chers collègues. J'aimerais t'inviter à Montreal as we co-host 2024 with ALS Canada. And I happen to know, I'm really glad she's not in the room because I just butchered her French. So, few questions. You have to, keep your own score here, and we're going to keep you honest on it. So, number one, what country is the executive director of the Alliance of ALS M&D associations from? Dun, 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 dun. All right. I hope you got that one. I really do. Can you name 2 Canadians at the Allied Professionals Forum this afternoon? Efrat, I hope you got this one. All right. Which country was first to approve Amylyx's therapy? But for a bonus point, what is the trade name in Canada? The trade name. What do we call Amylyx's therapy, AMX 0035? Okay, now we're moving a little bit outside of the ALS space. What major medical discovery that won a Nobel Prize in 1923 was discovered in Canada in 1922? And you get bonus points if you can identify at least one of the 2 people that was involved. I like that. All right. What province is Montreal in? Okay. And Richard, I feel like I need your backdrop of the Canadian flag, of the maple syrup. Where are you, Richard? There you are. Yes, come on up, Richard. I need some help. Oh, if you sing, you definitely get bonus points. And Quebec is famous for a culinary treat made of French fries, gravy, and cheese curds. What is the name? Okay, tally up your scores. Oh, right, we need the answers, don't we? I've got those. Okay, so what country is the executive director of the International Alliance of ALS M&D Associations from? Excellent. Can you name 2 Canadians at the Allied Professionals Forum? Tammy and Kathy. Excellent, but there's a third. 4th. Matthew. And you know what? I often find that there are many more Canadians in the crowd, so put up your hand if you're Canadian. Oh, we've got another one at the back of the room. Excellent. So you've got a few options there. Which country was the first to approve Amylyx's therapy? Canada. I hope you got that one. And what is the trade name? Albrioza. And the major medical discovery in 1922? Insulin. Thank you. And who was it discovered by? Banting and Best. Okay, all right. And what province is Montreal in? Excellent. And what is that famous, I heard it over here somewhere. Poutine, yes. All right, so who got highest scores at your tables? All right, then you get the mittens on your table. What was your score? 5. Did anybody beat 5? All right. Nobody beat more than 5? All right, well, there you go. So thank you. We look forward to welcoming you to Montreal. Pack your mittens. And for a bonus point, what would you be packing if you packed this? 2. Excellent. All right. And Richard, I'm coming your way because that was awesome. And the maple syrup was even more awesome. So we will see you the first week in December in Montreal. Au Montreal. See you there. Thank you.
All right, well, Tammy, that makes me want to go to Canada, though I don't think it makes a front want to go to Canada. It's a little cold. This is the end. Thank you. Thank you to everyone who made it here. It was a fantastic 2 days, jam-packed full of information. We heard from physiotherapists, occupational therapists, speech therapists, nurses. We heard from everyone. We heard about art. We heard about palliative care. Like, the breadth and depth was just amazing. And I appreciate all of you being here and learning. And I hope you can all take something back with you, as well as take back some new friendships. I know I made some new friends as well and met some old friends again. Do you want to say anything?
I think those people online, it's been extraordinary. Even the people that aren't in the room have been so interactive. And I've had texts and messages from my team at home and from patients, and they have been here with us and enjoying everything we have. So it's a wonderful opportunity when things are online to be able to spread it, and so many people have been watching. It's been amazing.
And the last thing we ask you to do is scan that QR code and send us your survey of what you thought. So we did have some new initiatives this year. Let us know what you thought about the programming and everything else. And that's it. Yay.